Hello, can you hear me all right?
I can. How are you?
I'm fine. I can't hear you terribly well. Hang on a second. I wonder why that is. Oh. It's my phone, is it? Okay. My son is here to try and help
Hi.
me sort it out.
Where are you,
Okay.
Victoria? Are you in England or are you in Barcelona?
I'm kind of, I'm in Spain. I'm not in Barcelona and I'm not in, in England either. Don't move that. I'm trying to make it, is it
That's
all right?
perfect. Yep, that's
Yeah?
absolutely perfect.
Okay. All right. Cool.
Thank you for joining. And to everyone in LGBT Mummies community, we'd love to welcome Dr. Victoria Walker from Institute Marquès Rainbow Fertility Barcelona. I can hear a reverb, but hopefully people can hear okay. Um, I'd love you to just share a bit more about the clinic and what you do and how you can support our community. Just give a bit of background for us.
Right. Yeah. So the Institute Marquès is a very old clinic. It's been around now for about 100 years. We're on the fourth generation of Marquès doctors, and that's just their family name. So we're very happy to be, it's a very small private clinic, and we try to look after patients on a really kind of individual, in a very individual way. And what do I do there? I'm one of the doctors. There's quite a big team of doctors now. We've got centres we've got an additional centre in Milan and in Rome. So altogether, there are quite a lot of doctors at the centre. And we've always wanted to look after all patients, of course, but with the LGBTI group, we've set up a new platform called Rainbow Fertility Barcelona that we would really like people to use and feel comfortable using. And that's trying to really just trying to help people from the LGBTI group expand their families in whichever way they can. The only people we can't help are single men, but otherwise we should be able to help pretty much anyone.
Brilliant. Thank you so much for sharing. And something that I'm really excited about that I think a lot of people probably haven't heard about in regards to what the clinic does. Can you tell people a bit more about the music therapy and what you do?
The music, okay, yeah, I can tell you about the music. Well, the owners of Institute Marquès are themselves very interested in music just generally, and there's when you think about how an embryo is made naturally, it's sort of, you get an egg that gets into a tube, into the fallopian tube, and then it's fertilized naturally by some sperm, and then the embryo travels down the fallopian tube and will meet the nutrients it needs and will get rid of its waste products. And so they were trying to think of what happens naturally and how it could be maybe replicated in the laboratory for people who don't make their babies naturally. And so they were thinking, what can you do to try and replicate this movement? And there were different groups that have tried different things. Some people have just had the whole place where you're keeping the embryos moving, but they thought maybe they would try music. And the vibrations that the music make to make the embryos move a bit in their incubators. And so they used music, and we tried classical music, we tried pop music, we tried heavy metal, and actually it didn't make any difference which type of music was used, but overall the music did improve the fertilization rate of the embryos when they were being created. So we've continued to do that. So now all of our incubators have these little iPods inside and play music, and if people have done a donation program where the embryos have been made, then they get a little video if they fall pregnant and things like that, and the music is used on that video, and so they get that. So it's a nice thing.
It's such an
And we
amazing
continue to
thing,
have
yeah.
concerts and things like that for the embryos, and there's music playing throughout the building, as there often is in many places nowadays when you're shopping or whatever. But there's people can choose music when they're having transfer and things like that. So we think about music a lot.
It's beautiful because it's something that we've never really heard of, you know, embryos being played music while they're growing, which is absolutely beautiful. And the fact that scientifically it's actually helping them grow, that's just
Yeah, it
absolutely
improved the
amazing.
fertilization rate by about 5%, so we felt it was worthwhile continuing.
Definitely. And I think you're the only clinic globally that we know that does that. So for anyone that's looking for a clinic that does something really amazing and unusual, you are right for them. And even throughout the whole clinic, you have musical notes hanging in your waiting area, and all your rooms are decorated in a very calming, therapeutic way so that people feel
That's right.
a bit more, well, less stressed, more engaged with what they're about to go through, right?
That's right. That's the idea, to try and make the whole. I mean, music is designed to try, when people have it, when they're shopping, whatever, is to try and make everything calm down, make people not get stressed, and it works in the same in clinics. And so yeah, we've got everything is designed for that to be the case. And then the other thing, yeah, we try to think of everything. Sometimes they make certain smells around the rooms to try and make that feel more, make it calm, help people to calm down as well. So overall, yeah, we're trying to think about the person in all ways, and what they might
Yeah, and
need
to
to
give them a different
make the whole process
experience.
easier for them.
Yeah, exactly. To make it a more enjoyable experience, because we all know going through fertility treatment is very anxious anyway, a very difficult process. So you want to go through it and actually try and enjoy it. So having beautiful spaces around you and music is probably a great way of actually being able to enjoy it more.
That's right. Well, that's what we hope. It's, no fertility treatment is that easy. Psychologically, it can be very hard work. But if someone's making the environment a bit nicer for you, that can help.
Can you talk a bit more about your amazing embryo donation program? Because
Yeah,
that's
I've got
something definitely we
rather a
wanted to
lot
cover.
to say about that. So yeah, no, I'd love to tell you about the embryo donation program, because I think it's a really nice program. And it's particularly good for the LGBTI group, because we really, there are so many women who enjoy doing this treatment and feel it's right for them. So yeah, I'll go through everything that I have to tell you. So basically, adopting an embryo just means taking giving the opportunity of life to embryos that have been frozen after an IVF or an egg donation treatment. These embryos all come from very healthy people who finish their reproductive project, so they don't want any more
Yeah.
children. The great majority of the embryos come from egg and or sperm donation, and in all cases the woman is under 35 years of age, so we feel that the embryos have great implantation potential. In 2004, we actually launched this program, the Embryo Adoption program, in a bid to give these embryos a new chance of life, because they were just sitting there in the incubators.
Yeah.
And it's a program that's being received with great enthusiasm by many people and many groups in society. And so today we've got now one of the highest numbers of any adoption program worldwide, with over 2,000 children born so far from the process. So what kind of success rates can embryo adoption programs give? Well, per transfer, you're looking at about a 57% positive pregnancy test rate. So between 5 and 6 women per 10 women who try will fall pregnant. And and then 48% will have a clinical pregnancy. So nearly half will achieve a clinical pregnancy per transfer, so each time they try.
Yeah.
And of those, only about 2% will be twin pregnancies, because we really emphasize the need for single embryo transfers. We recommend that very much. So who would consider adopting these embryos? It's quite often single women who are no longer able to use their own eggs. They've tried naturally, they've tried via insemination or IVF, and they've not been successful. Female or heterosexual couples who've not had had success with their own gametes, either naturally or via IVF. Sometimes women who've had recurrent miscarriages. They don't really know why, but they're really tired of having to go through it again and again, and they'd like to try something different. And then there are women who have, for religious reasons or for ethical reasons, they don't really want to try a fertility treatment with their own gametes, but they're happy to take, adopt an embryo as they might a child. So what does it involve? What does this process involve? Well, first of all, the thing is that there is no waiting list, and that's really nice to know, that you can, once you've said go, as it were, if you're ready to go in terms of the medical tests and everything, then you can just start. And that's really nice. It's kind of reassuring that you're not going to have a long wait to get started. And the second thing is that there's no formal adoption process. You just sign the consent form for treatment. So it's in that way, it's not like adoption of a child. You don't have to go through loads and loads of paperwork for that. So how do we organize things? Well, we allocate an embryo, and I'll go through in a bit more detail about that. But then for the actual treatment, the woman on day 1 of her cycle will start with oral estradiol. Now, I'm assuming that, a lot of women will still have a menstrual cycle, but we can still treat women who don't have a menstrual cycle as well. So women who are under 50 but are perimenopausal or menopausal, we can still work with them with slightly different medication in a slightly different order to help them to have this treatment. But assuming that most women do still have a cycle, then on day 1 they start with oral estradiol. After a week they have a scan in their own country, so the UK or wherever you're living, and you send us the report of that. And if that looks fine, then you start some vaginal progesterone and have embryo transfer a few days later. And so what does embryo transfer involve? Well, it's pretty similar to having a cervical smear. So you're completely awake, there's no anesthesia, no analgesia, unless you want some because you're worried, but most people tolerate it really well. And you're put into the gynecological position, and they pass the speculum into the vagina, that metal thing to separate the vaginal walls, and then they come from the laboratory with a catheter. So a catheter is it's a bit like the inside of a biro kind of thing. It's flexible and thin, and in there you would have your embryo, and they would then use this very thin catheter to pass it up through the vagina, through the cervix, all done under ultrasound guidance, and then deposit the embryo just at the entrance to the uterus. And then you withdraw the catheter, and the patient lies there for about 5 minutes, whilst in the lab they check that the embryo is definitely gone from the catheter. And then once they say yes, then the patient can get up and go straight home. Again, they can fly the same day or go visit Barcelona, or whatever they want to do. And they need to continue, though, with the medication until the pregnancy test, which is about 10 days later. And if that's positive, then they increase the doses and keep going for another 8 weeks. And that's really all there is in terms of the preparation. We tend to transfer a day 5 embryo. We try to make sure that the embryo is synchronized with the endometrium, so it's a day 5 embryo that goes in, and it's a single embryo transfer because we want to minimize the risk of having twins. Twins is a wonderful idea until you actually have them. I think the pregnancy is hard, the delivery is hard, and the life afterwards is wonderful but hard too. So we really don't want people to have twins if we can avoid it. So to come back very briefly to the allocation of the embryos, essentially the embryos are sitting in our bank, and I'll talk a bit more about that in a minute, and then we choose them according to the race of the recipient. So if you are black, you will receive an embryo that comes from 2 black people. If you're white, the embryo will come from 2 white people. And so on and so forth. So if you're mixed race, you'll get an embryo that's from mixed race people. And so it's an embryo that is racially matched to you. And then we monitor where the embryos go in the world, because we don't want them all going to the same town or the same country. And so we make sure that they're being well distributed. And to give you an idea, the last 500 transfers have gone to 24 different countries.
Wow.
So just, I've got the list here of where they've gone. So they've gone to Spain, Italy, the UK, France, Germany, Switzerland, Norway, Holland, Ireland, Belgium, Bulgaria, Sweden, Austria, Finland, Mexico, the USA, Australia, Algeria, Argentina, Guatemala, Canada, Russia, Albania, Morocco. So
Wow.
plenty
All over the world.
But all over the world, and that's good, because you don't want anyone in any way to come across any siblings or anything like that.
Again, marrying someone, if they grow up and then they go to marry someone, they might be genetically linked. You have to be very careful with that as well. So it's good that you're really mindful of that.
So you have to watch where everything goes and make sure, we always register when people, let's say people say, oh, I came to the clinic because my friend came. And they were successful. You think, oh, great, that's wonderful. That's a really good reason to come. But at the same time, we make a note that they know each other. Make sure there's no way you could give them the same donors or the same embryos or anything like that, because you've got to be careful about that. So people come from all over the world for these treatments, but the only time they need to be in Barcelona is for the embryo transfer.
Oh, that's good.
They don't need to come any other time. The rest of the time, everything's done in their own country, and they send us the reports of everything. So very briefly, how do we get the embryos? Where do they come from?
Yeah.
People are quite curious often to know where they come from. So as I said before, they all come from healthy women under the age of 35, and the great majority of these women are egg donors. So they come and they're vetted by the medical team to make sure they're healthy in themselves, that their families are healthy, that they don't have any illness we think they could pass on. And then they go on and make their donation for somebody who's doing an egg donation treatment. That person, the recipient, uses some of the embryos, and then when they finish their family project, so they don't want any more children, they then have to decide what they want to do with their remaining embryos. So they can choose to keep the embryos for themselves, or they can give them to science, or they can destroy them. But the final option is to donate them to other people. So some people will do that. But other people find it very hard to make a decision as to what to do, and so they don't make any decision. They just leave it. And so if an embryo is left for 3 to 5 years, where the people for whom they were made say nothing, then the law in Spain allows us to take those embryos and evaluate whether or not we want to put them in the bank. So we, the medical team, get a list of embryos sort of 3-4 times a year, embryos that have either been donated or abandoned. And we then go through that list, trying to work out which embryos can be accepted and which ones can't, according to the medical criteria that we use for accepting embryos. And so when they go in, we just leave them there. We don't really differentiate whether they were abandoned or donated, or whether they come from double donation or donor egg and a husband's sperm. They're just in there, and then we allocate them racially to the recipients. And so I don't know if you're interested, but a little bit of information about how an embryo is frozen, if you want. So it's how long can an embryo be frozen for? Well, the embryos can be frozen at any point in the first 5-6 days of their life, and so during that time, an embryo is developing inside the shell of the egg. It's only at the end of the first 5 days that it starts to break out of the egg, and then start to implant. And so if we've got an embryo, we usually wait until day 5 or 6 of the life of the embryo until it's a blastocyst, and then you immerse it in a cryoprotectant, and then you take the temperature right down to -196 degrees centigrade, and put it in a little straw, and it's a coloured straw, which then goes into a little coloured pot, which then goes into a tank of liquid nitrogen, and the tank can hold up to 10,000 straws.
Oh my gosh, that's a lot.
It's quite a small tank, and you think, how can they all be in there? But they are all in there. That's a lot of embryos, and they're all coded so that they can be followed wherever they're going around the lab, when they're being taken out, defrosted, used, whatever. And so we know exactly who made which embryo, and we can follow them in and through the log of all the embryos.
That's amazing.
And so that's, I think, really all there is to say about the embryos. The great majority, as I say, they've all come from women under 35 years of age. So we think they are all healthy from a genetic perspective. But only a very few of the embryos have actually been genetically tested. So you can request a genetically tested embryo if you want. But the majority haven't, and they're fine, and they give very good statistics.
So people can come to you. So people can come to you, and they can have difficulties with conceiving. They could have decided that they don't want to use their own eggs, or they could actually have no eggs available to go for treatment. And they come to you and they can say, I want to adopt an embryo. Is that something I can do? Or you could have someone that has treatment with you, has embryos stored with you, and says, actually, we don't want to discard them. We don't want them to go to science. We want to gift them. We want to give them back to the clinic to give to a person or people, whatever their family makeup is, to start their family. So there's different people that will come and use the embryo adoption service, right?
Yeah, that's right. That's right. So people come, all different people come, and they can, exactly what you've described. They can say all the different things. People can donate embryos to us, or they can, or they can say we want to take an embryo, or whatever their circumstances are.
Yeah,
we can help them with that.
And are you seeing a rise in people needing access to egg donors or even embryo donation more so now?
Yeah, absolutely. I mean, it's been a phenomenon for a long time, really, I suppose since the 60s, when women started to be able to choose when to have their family, and they started to have lots of other things they wanted to do, careers and all the rest of it, and suddenly people have just left it too late for their bodies. The human body is still designed to have children between probably the age of 16 and 36, pretty much, less so in your late 30s or early 40s, and yet today it's quite unusual to have children under the age of 30. It's not unheard of, but it's less
Doesn't happen as
than
often.
it used to be. That's right. People are thinking, they've got to try and get a career going, try and get their house, try and get a bit of stability before they start having a family.
And as a community, we have children exponentially later on in our lives, because we tend to settle down later on. What is it about embryo donation? Is there an age cap where you won't donate an embryo that you have within the embryo donation program to a woman or person over a certain age, or is it that you will provide that to anyone at any age?
The embryos have to have been created from a woman under 35. Legally, she can't be over 35, but the recipient can be up to 50. Be up to 50. So anyone between the age of 18 to 50, I suppose, although we'd never get the younger people, but it's up to 50 years of age, provided you're healthy. I mean, if you are yourself not in terribly good health aged 50, then we would find it hard to treat you. We want you to be a healthy person. But if your doctor says you are healthy, you've got quite a normal BMI, or a BMI that you're trying to get under control, you don't have very significant illnesses or anything like that, then you can usually have treatment, and it's not a problem. And it's an easy treatment to do, because it's generally just orally and vaginally that you take the medication. You don't normally need injections, and that appeals to quite a lot of people as well.
Perfect. So just to recap for people, you provide really inclusive care to the LGBT plus community, and have done for 100 years, which is amazing. On top of that, you provide music therapy to embryos, a really calming space for people to come and have their treatment, and they don't always, depending on what country they're in, have to come out until just before transfer, which is great. And then to top that off, you have an embryo donation program that people globally can either donate into, or they can come to you to be the recipient of embryo donations. So that's just amazing. So if anyone is looking to start their journey or wants further information on being a donor, please you know, reach out to Institute Marquès and reach out to Rainbow Fertility Barcelona and give them a follow, get involved. And are people able to reach out to you directly or any of the medical team to ask these questions?
Yeah, of course. So if you get in touch with us, we then, so you can do it via the website. That's usually the easiest way. You just directly log in that way and ask for an appointment, and you get a free first visit of at least half an hour with the doctor, who will just review your history and find out what you want to do, what you'd like to do, and then we decide together what kind of tests you might need, if you need any at all, and then you take it from there. And it can be very quick. You know, I saw someone today, and she said she's having her next period in 22 days, and she'd like to get started then. And so, you know, by the end of the summer, you know, who knows, she might be pregnant. But it is a very quick process. It can really go very fast.
And there's another thing that you do that's really amazing, that we also at LGBT Mummies do, that I'd love for you to tell people quickly about, is your forest of embryos. So can you tell people about that? Because we plant trees for every baby born, but your clinic plant trees for every, I'll let you explain.
Yeah, well, every baby born as well. Yeah. So, so we've had that going, I think, probably about 5, 6, 7 years. The directors got involved with an ONG, yes, well, anyway, a charity. And so every time a baby is born from one of our treatments, we ask the parents if they want to plant a tree. And it's a reforestation project near Tarragona, so not very far away from Barcelona. And we just try to plant the tree as quickly as we can. The planting is quite difficult here in Spain because it doesn't rain very much. Yeah. So the times of year when you can plant there aren't that many, but otherwise that's what we aim to do for each child. And then we put a little plaque beside the tree with the name of the child if the parents want that.
That's amazing. Thank you so much for joining us today and sharing about the amazing initiatives the clinic are doing. And if anyone wants to reach out, please give them a follow. And I can't wait to share more about the clinic and what you're doing. But thank you so much, Victoria, for joining us.
Pleasure.
Thank you.
Speak with you again.
Definitely.
See you soon.
Speak to you later.
Bye-bye.
Bye.